bit about myself. So recently, as closely as April, I relocated to this area from Missouri. I've been traveling to Wyoming my entire life, visiting older siblings who are in college working in the Tetons, as college kids oftentimes do. And those three siblings actually moved out west years ago, and just took me a little bit longer to get here than them. But glad to be a resident of Wyoming and glad to be part of Fremont County. We are going to be in the same building as Community Health Pediatrics in Lander, and we currently have a presence here in Riverton, and we're increasing that as well. Currently on Wednesday afternoons, I see patients at the Community Health Center, and because of the need and volume of patients, we're going to expand that to a full day on Wednesday. And we are also going to have a presence at the Wind River Clinic right next to the hospital. Currently they're on Wednesday mornings, and we're going to move that to Monday mornings, hopefully, or Monday afternoon. Still in the process of working out all the details. So proud to be in Riverton and hope to be able to contribute and meet the need of patients here who have been gracious and awesome patients to take care of at those two locations. Today we're going to talk about pelvic pain. May is Pelvic Pain Awareness Month, so I'm a little bit late about getting here for that. But let's look at the definition of pain. It's the unpleasant sensory and emotional experience that's associated with actual or perceived damage to the body. So there is a physical component and emotional component. When I'm in pain, I had a kidney stone once, that made me cry. And we have an emotional component to pain. Today, we're going to talk about pelvic pain. So what is pelvic pain? Pain that occurs somewhere between your belly button, or in the medical field, we like to say your umbilicus, so you can impress your friends next time and have reference to your umbilicus, above your legs, below your belly button. That's what we define as pelvic pain. As my patients oftentimes do, I got on the computer and I Googled, what causes pelvic pain? And came up with a short list of only 18 things. Appendicitis, irritable bowel syndrome, middle schmerz or ovulation pain, PMS and menstrual cramps, ectopic pregnancy, STDs, the most common being gonorrhea and chlamydia, pelvic inflammatory disease, the #1 preventable cause of infertility, ovarian cysts, uterine fibroids, endometriosis, urinary tract infection, kidney stones, interstitial cystitis, pelvic organ prolapse, pelvic congestion syndrome, scar tissue or adhesion formation, and vulvodynia. If you need a list, see me later. So, treatment options include medication or surgery or physical therapy. And we're going to talk more about that as we go along. And in treating that, sometimes that also involves painful intimacy or painful sex. Chronic pelvic pain is then defined as pain that's been persistent for at least 6 months. So I don't know about you, but if I get up every day and I'm experiencing some sort of pain that's disrupting my life, my ability to complete my activities of daily living, like we say, go to work, take care of my family, my kids, play with the kids, fix food, do the laundry, whatever the case may be, it's a big problem. How big a problem is it? Well, the United States alone, approximately $881.5 million is spent to cover the costs of direct health care, going to the doctor, going to the pharmacy and picking up medication, having surgery, or any other directly related healthcare costs. However, there's approximately $2 billion, with a B, $2 billion spent on overall costs, including the direct medical costs, as well as indirect costs, such as those related to absenteeism from work, all because of pelvic pain. Chronic pelvic pain affects 1 in 7 U.S. women, the cause being frequently undiagnosed. Around 60 to 80% of people with persistent pelvic pain experience depression, and over 65% have associated anxiety with their condition. Patients report feeling isolated because no one can relate to the pain that they're experiencing. They feel misunderstood. They're oftentimes misdiagnosed. They complain of having to pee or urinate all the time and taking forever to start their urinary stream. They complain of pain during or after intercourse, affecting their most intimate relationships with their loved one. Today we're going to focus on 3 areas because this is a big subject. There's lots to talk about and there's no way we're going to cover it all today. But the 3 areas that were sometimes taught in medical school, if you have pain somewhere, shoot an arrow through that spot and everything that it touches can cause you pain. Well, between the umbilicus and your legs, we're going to talk about your bowels, your bladder, and everything in between, which oftentimes involves the gynecologic structures or women's female reproductive organs. And by the way, men have pelvic pain as well sometimes, but it's only about 1% or less of the entire population that has pelvic pain. Let's talk a minute about your bowels. I don't know if any of you, have an aunt, an uncle, a grandparent, or somebody in the nursing home or elderly, but bowels frequently become a preoccupation. And, when we talk about pain that's associated with bowels and constipation, which is epidemic in this country because we're not out splitting wood, hoeing corn, and eating fiber. We're driving through McDonald's and going home and sitting in front of the TV and doing whatever. And so our lifestyle, our dietary consumption has changed from what it was years ago, and constipation is absolutely epidemic. Patients with irritable bowel syndrome, which is sometimes referred to as the alternation between constipation and diarrhea, consume more overall health care than those without irritable bowel syndrome. So 10 to 15% of patients have irritable bowel syndrome. Only about 5 to 7% of those see a doctor, and yet they consume more healthcare costs than all the other people without irritable bowel syndrome put together. Standardized testing is oftentimes normal. Labs, x-rays, you name it, they all come back normal. This is a diagnosis based upon symptoms. Pain occurs due to alterations between the brain and your bowels, the gut connections. It's known as the brain-gut axis. Pain occurs in some individuals, which is not perceived by others. And that process then causes a person who's going through their normal daily activities to have significant pain when going through the same process as a simple bowel movement that other people do not have pain associated with. When we think about bladder pain, we talk about overactive bladder, that desire of urgency and frequency. I've got to go to the bathroom and you better get out of my way because I've got to go right now. Chronic interstitial cystitis, a term that most of you are probably not familiar with. The average patient at one point in time was said to have seen 6 to 7 physicians before having an accurate diagnosis. Painful bladder syndrome kind of encompasses a little bit perhaps of all of that. Overactive bladder, again, being associated with urgency and frequency. Have you ever noticed when you're on a road trip that somehow the man driving the vehicle becomes the bladder god? Honey, we need to pull over so I can use the bathroom. Can we wait till we get to the next stop? It's just around the corner. It's just up here, just a little ways farther. Well, the treatment for overactive bladder consists of multiple modalities. Certainly changes in diet, decrease in caffeine intake, acidic foods and beverages, which contribute to irritation of the bladder. Have you ever thought, a baby's bottom, almost everybody's seen a baby who's had a terrible diaper rash from sitting in a wet diaper too long. How come our bladder doesn't respond in that same way, becoming irritated, inflamed, even to the point of bleeding? Well, it's because there's a protective layer inside the bladder, but that layer can be damaged and actually eradicated, and that leads to painful bladder syndrome, chronic interstitial cystitis. There are multiple ways that we address this issue and treat it, including nerve stimulation. There's a device called InterStim, and it uses a implantable battery very similar to a pacemaker, specific electrodes placed in the sacrum of the spine to help overload and ultimately decrease nerve stimulation to the bladder, causing people feeling like they have to run to the bathroom all the time. There's percutaneous tibial nerve stimulator. We take a little acupuncture needle, we place it in your ankle, we hook it up to a car battery, actually just a small little battery with a rheostat, and it stimulates that nerve in an effort to decrease, again, that overstimulation. TENS units, transcutaneous electrical nerve stimulator. We put these patches on your back in specific locations, turn up the juice a little bit, and again, in an effort to decrease these abnormal stimulations to the bladder. Myofascial pain, where our physical therapists come into play. 56% of patients with overactive bladder will have pain and tenderness in the myofascial region of the pelvic. The myofascial refers to the muscle and the connective tissue around that muscle. When the bladder becomes hyperactive, it recruits muscles in the same area. And so the pain starts in a small spot, the bladder, and then extends to the pelvic muscles, which line the entire skeletal muscle of the pelvis. There has been reported improvement in up to 80% of patients who have overactive bladder by treating myofascial pain. There's much more to say about painful bladder syndrome, its complexities with pelvic pain, but we're going to move on today in the sake of time and wanting to accomplish a few things here in regards to my specific specialty, but I deal with all of those things on a regular basis because there's such a dramatic overlap. Gynecologic origin of pain. Certainly, one of the most important things that we can do in treating any type of illness is obtain a correct diagnosis so that we can then provide a correct treatment. The diagnosis sometimes is that of exclusion. Just like with irritable bowel syndrome, there's not oftentimes a specific blood test, an x-ray, an ultrasound, or a CAT scan that we can do that tells us exactly why maybe a person's experiencing pelvic pain. Sometimes the answer may be more obvious. Infection, we give a person antibiotics. Appendicitis, yank that thing out. Ovarian cyst, poke a hole in it and drain it. But it can be more difficult and quite challenging at times. Mittelschmerz, kind of a neat German term that refers to the middle of a cycle where a woman undergoes ovulation and the pain associated with that. PMS, how can we stop premenstrual syndrome? Well, by eradicating your cycle, sometimes by being on continuous birth control pills, for instance, sometimes using the Nexplanon device that goes underneath the skin in a person's arm. It's good for 3 years, and it stops the cycle as we know it. How about endometriosis? Endometriosis being the condition of endometrial tissue, which grows inside the uterus, growing anywhere else. And every time a person has a cyclic month, that stimulates that endometrial tissue, which then bleeds, whether that tissue is located on your bladder, your bowels, or the peritoneum, which is the lining inside the abdominal cavity. All of these things causing significant pain. That particular diagnosis being made surgically. Bowel and bladder problems that we already talked about and how they contribute to pelvic pain. An estimated 50% of cases of pelvic pain remain without a specific diagnosis. However, testing can be useful, although it may not give us the exact diagnosis of why a person has pelvic pain. It may be useful in giving us a clue in diagnosing what we call comorbid conditions, other conditions that we've already discussed, which may be contributing to the development of chronic pelvic pain. Chronic pelvic pain is a form of what we call centralized pain, and it's where the body develops a low threshold for pain. Now, we've had a younger sibling, an older sibling, or somebody who we said, well, they have a very low pain, threshold. Anything is so dramatic, the way they respond, so on and so forth. Well, let's talk about centralized pain because it's a condition that actually builds and leads to that. So what previously was a mild to moderate pain is now experienced as a severe pain, or what we call hyperalgesia. Endometriosis, for instance, that particular condition recruits additional pain fibers. The longer you have the condition, the more pain nerve fibers are stimulated and recruited to produce more pain. The exact same condition becomes more painful as a part of the nature of the disease. The relationship between chronic pelvic pain and comorbid conditions, as we talked about, is often the primary focus of the diagnosis and management. So sometimes the treatment is global and looking at multiple different things. In over half the cases of chronic pelvic pain, there is a comorbid condition that needs to be treated. Most women have symptoms of chronic pelvic pain, do not seek treatment for at least 2 years from the onset. So kind of wrapping it up, only 1/3 of women with chronic pelvic pain actually ever seek medical care. There's an emotional state and stress levels which increase our perception of pain, sleep deprivation due to pain, which then makes the perception of pain worse. Chronic pelvic pain, 35% of patients with will have irritable bowel syndrome. 61% of patients with painful bladder syndrome have chronic pelvic pain. 70% of patients with endometriosis have chronic pelvic pain. And 99% of all chronic pelvic pain occurs in females. Treatment includes medications, analgesics, neuromodulation. We have medications that change the way our body perceives the signal of pain. We talked about nerve stimulation, whether it's percutaneous, a permanent implanted device, or the use of acupuncture needles, isolating nerves that we then stimulate. and physical therapy. We talked about myofascial pain and the role that physical therapy has, and dramatic response with, greater than 80% of those patients having improvement of their symptoms. So today's takeaway message: chronic pelvic pain, not something we talk about when we sit around and have lunch together, but yet affects a lot of people with some very significant implications. Over $2 billion spent in direct and indirect medical costs. So your job today is to go forward with a little bit increased knowledge of pelvic pain, how it affects the people around you, and the fact that there is something that can be done about it. I would just encourage you that if you know of somebody who's experiencing any of these things we talked about, whether it's something as simple as, premenstrual disorder or Mittelschmerz, great word there, or chronic pelvic pain, we're happy to see those patients and feel like we have something to offer to them.